Welcome back. In today's video, we're going to have an interactive Q&A where we'll explore the challenges that healthcare systems face when it comes to managing depression in different regions of the world. Depression is a global issue, but how it's treated and managed can vary significantly based on geography, resources, and cultural attitudes. Today, we'll discuss these challenges and share potential strategies to overcome them. Let's begin by discussing some of the common challenges in low-resource settings. In many low-income countries or rural areas, one of the biggest challenges in managing depression is the lack of mental health professionals. There may be very few psychiatrists or psychologists available, which can make it difficult for individuals to receive the care they need. In these areas, task shifting plays a key role in addressing this issue. Task shifting involves training non-specialized healthcare providers, such as nurses or community health workers, to manage depression and other mental health issues. For instance, in rural Africa, community health workers can be trained to screen for depression, provide basic counseling, and follow up with patients. These workers can play a vital role in providing mental health care in places where specialized resources are scarce. However, the challenge here remains: how do we equip these workers with the tools, training, and support they need to effectively manage depression in such settings? Reflection question: how can task shifting help improve access to mental health care in low-income regions where mental health professionals are scarce? What additional resources and training might be necessary to support non-specialized healthcare providers in managing depression? Now, let's consider the challenges in high-income countries. While high-income countries generally have more access to mental health services, these regions also face significant challenges. One of the most prevalent issues is the fragmentation of care. Even though mental health services might be more accessible, patients may have difficulty navigating the complex healthcare systems, leading to delayed treatment or inconsistent care. For example, in many Western countries, depression care is often provided by separate mental health specialists like psychologists and psychiatrists, whereas general practitioners, GPs, manage physical health. This fragmentation can create barriers for patients who need coordinated care. The challenge here is how we can integrate mental health services more seamlessly into primary care, ensuring that depression is addressed holistically alongside physical health concerns. Another challenge in high-income countries is the stigma surrounding mental health. Despite increased awareness of depression and other mental health disorders, many individuals still feel ashamed or reluctant to seek help. How can we reduce stigma and encourage people to seek treatment when they need it? Reflection question: how can we integrate mental health care more effectively within primary care settings in high-income countries? What strategies can be used to reduce stigma and encourage people to seek help for depression? Now, let's turn to the cultural challenges in managing depression. Culture plays a significant role in how depression is viewed and treated across different regions. In some cultures, mental health issues like depression are seen as a stigma or a weakness, while others may prioritize family involvement or spirituality in managing emotional well-being. In countries like India or China, there is often significant stigma associated with depression, and individuals may be more likely to seek help from family members, religious leaders, or traditional healers rather than medical professionals. This presents the challenge of how to bridge the gap between traditional beliefs and modern mental health treatment. On the other hand, in Western countries, the focus is often more on individual treatment through therapy or medication, which can sometimes overlook the family or community context of the patient's life. It's important to consider how we can incorporate family support, community involvement, or spiritual practices into the treatment plan to make the intervention more culturally appropriate. Reflection question: how can healthcare providers offer culturally sensitive care to individuals from different cultural backgrounds? What steps can be taken to integrate traditional beliefs and modern treatment methods in depression care? Addressing the global mental health crisis. Despite the challenges, it's clear that global collaboration is key in improving depression care worldwide. The World Health Organization, WHO, and other international organizations like Mental Health Europe, and the World Federation for Mental Health have been working to increase awareness and reduce stigma around depression. They also emphasize the importance of task shifting, community engagement, and integrating mental health services into primary care. A global approach to depression must address the unique challenges faced by different regions. This could involve expanding access to mental health care through community-based interventions, training non-specialists in low-income countries to manage depression, educating communities about mental health to reduce stigma and encourage help-seeking behavior. Reflection question: how can global collaboration help improve depression care, especially in under-resourced regions? What are the most important steps to take in addressing the global mental health crisis? To summarize, managing depression globally requires understanding and addressing the challenges faced in different regions and healthcare systems. Whether it's tackling stigma, ensuring accessibility, or providing culturally sensitive care, each country faces its own set of hurdles when it comes to providing care for depression. However, by sharing strategies, learning from each other, and promoting global collaboration, we can ensure that depression care is improved on a global scale. In the next video, we'll move into practical case-based projects where you'll be asked to create personalized care plans for a variety of depression scenarios. Let's keep it going, and I'll see you in the next one.